Hi, I'm Dr. Steven Nieto, physical therapist with Marketplace Physical Therapy. I've been in practice for over 2 decades now, and today I'd like to talk to you about the number one condition we see in clinic every single day, that being low back pain. In fact, some 65 million Americans every year experience back pain to some degree. It's also the leading cause of lost time at work. In today's society, we're becoming more and more dependent on our digital devices, which is rendering us more sedentary, which is a huge predisposing factor towards low back pain. In this video, I'm going to show you some stretches and exercises that you can do on a daily basis to help minimize your risk of developing low back pain. This is the PIRIFORMIS stretch. In this stretch, you will bend your left leg, crossing your right leg up and over, reaching through your legs, grabbing your knee, pulling gently up towards your chest. Now you'll feel this stretch deep in that right buttock area. This is a very important stretch as sciatica is a very common low back pain experience. This is one of the main exercises or stretches that we give for this condition. You want to hold this slow and steady for a 30-second duration, repeating 2 times on both sides. Hamstring stretch. With this stretch, you can find a towel, a belt, a dog leash, anything you have around the house, and loop it around your foot. Now you want to keep your opposite leg flat on the ground as you gently pull your leg upward to the point where you feel a moderate stretch on the back of your leg. You want to hold this slow and steady for a 30-second duration. Having flexible hamstrings is very important for maintaining proper spinal alignment. You want to repeat this 2 times for both legs. In the lying position on your stomach from a firm surface, put your hands out as if to do a push-up. Now you're going to keep your pelvis flat on the floor as you press up using your arms. You'll feel tightness or stiffness in the lower back and go ahead and return back to the ground. This is a very important exercise as most of the time our lumbar spines are stuck in an opposite position, what we call forward flexion. You want to do 10 repetitions of this exercise for 3 sets. Each repetition holding the pause on top for about 3 seconds. It's normal to feel some stiffness in the lower back. What we don't want is sharp or shooting pain. This is a core stability exercise. You put your hands straight up over your head, lifting opposite arm and leg from the ground, alternating back and forth. With each repetition, hold for about 1 to 2 seconds, focusing on stability. Note that you're not going to be raising your arm or leg too far off the table. 1 or 2 inches is sufficient. Repeat this for 10 repetitions per side for 3 sets. In this exercise, we call it the dead bug. You'll bend your knees so your feet are flat on the ground, arms straight up above you. You'll take your opposite arm and leg up and down while maintaining a nice tight core. This is the entry-level demonstration of the exercise. You can progress to legs up, floating in the air. This is a much more challenging exercise. It's great for core stability. Now, if you can't do this right off the bat, it's okay. Start as we demonstrated. You'll want to repeat for 10 to 15 repetitions per side. Repeat 3 sets. Now, this is a traditional yoga exercise called child's pose. In this exercise, you'll start in the kneeling position, splay your knees out wide to your comfort level. Slowly work your hands down in front of you, gently feeling a stretch to the lower back. You want to hold this position for about 10 seconds, then gently walk your hands over to the left-hand side. As you do that, you'll feel more of a stretch on that right lower lumbar spine area. After 10 seconds, go ahead and walk your hands all the way back over to the right hand side, now feeling the stretch on the left hand side. Returning back to center, and then slowly walking your hands back up to the start position. You want to repeat this 5 times. Now understand, nothing will guarantee that you won't experience low back pain at some point. But trust me, doing these exercises with some consistency could greatly reduce the risk of you developing low back pain. And if you do develop low back pain, your likeliness of having a severe case will be less and your duration could be less as well. Now I want you to hit these exercises consistently for at least 2 weeks before expecting to see any benefit. Now, if you do experience low back pain, we highly advise that you contact your medical professional. Research shows that early intervention, including physical therapy, can greatly reduce the intensity and duration of your symptoms. If you have any questions, please feel free to contact us. Our therapists are more than happy to sit down with you and speak with you about your specific condition.